This is Pet Life Radio. Let's talk pets.
Hey, cat lovers. Welcome to 9 Lives with Dr. Cat. I'm your host, Dr. Catherine Prim, and I'm a small animal veterinarian and avid cat lover. Recently, I was invited to be a guest on another show, and I thought that you might be interested in what we talked about, because we talked about making veterinary visits better for all pets, and cats are always a part of that equation. So we'll take a quick break, and then we'll come back and hear my adventure with VetCandy. We'll be right back.
Does your dog itch, scratch, stink, or shed like crazy? Come to Dynovite for help.
Order a 90-day supply of Dynovite.
Dynovite for life.
Pick up 2 tubes of Doggosuds.
Get the 3rd tube free.
Peppermint, tea tree, lavender, Doggosud shampoo.
Made with all-natural coconut, jojoba, aloe. Great for healthy skin and soft, shiny coats.
But no itchy, harsh chemicals.
Lather up, rinse away.
Try Doggosuds. Buy 2, get 1 free.
At Dynovite.com.
DINOVITE.com.
Let's Talk Pets on PetLifeRadio.com.
Welcome back.
Welcome to another episode of VetCandy's podcast, In Other News, a podcast to expand your idea of what is impacting the veterinary world, veterinarians, and all animal care professionals as humans. We are your co-hosts, Dr. Jen.
And Dr. Jason Chatfield.
If you are not yet a VetCandy subscriber,
why not?
Please subscribe for free today at myvetcandy.com. If you also want to shout out to Dr. Jason and me, you can reach us at Jen at myvetcandy.com.
Or Jason at myvetcandy.com.
Great. Our topic today is happy veterinary visits.
In other news, pets and owners can enjoy a vet visit? No way.
Yeah, I mean, I'm ready to hear some great tips on that. I don't know about you, Jason, but I've seen some dogs that don't necessarily want to be there. Never, but rarely see a cat who wants to be there.
I was going to say, cats are an interesting breed when they get to the clinic, for sure.
Oh, yes, they're special. And there's a very, very narrow swath of owners who were ecstatic to walk into my exam room, right?
That's true.
Yes. Okay. So luckily, there were smarter people than us out there.
Very few. Let's make that clear. There's very few smarter people than us.
But luckily today,
we found one.
Yeah, we found one. So Dr. Cat Prim is joining us today. Dr. Cat, how you doing?
I am doing great. And I was going to say, cats don't mind being in my exam room.
Oh.
Well, then I think we just get right to it. How on earth did you manage that?
Yeah.
Well, I still have some cats that are afraid, of course, but I make a point to not push the cat to the point where it feels like it needs to defend itself. Mm-hmm. But I also have some ideas for ways to make that happen. And I call it be an animal. That all the veterinary professionals think like an animal and consider the way the cat or even the dog might perceive your veterinary environment. So I think that is a good framework for starting to make vet visits better.
Okay, Dr. Prim, I can't go whole hog, pun intended, whole hog, as you clearly haven't changed my name to Dr. Dog, because you're Dr. Cat. Is that why did you start off ahead of us? That's what I'm thinking.
Well, I think you need to talk to my parents because they named me this.
And then they subsequently said you have to be a feline lover, right? That's correct. And you have to have the best exam room for cats.
Yeah, it was understood.
Right? Understood. Right.
It was understood. So I guess we're going to maybe hear some tips from you, maybe like, I don't know, some 5 tips. But wait, I digress. Hang on. Stop the bus. Newshounds. I would like to know, Dr. Cat, where are you coming to us from today? Where are you located?
I am in Tennessee.
In Tennessee. Okay. So I think that we should probably go ahead and make sure everyone's aware that you're in Tennessee and you have a lovely exam room, clearly, as you mentioned. I am at the farm, and Candyverse, prepare yourselves. Dr. Jason has exited the basement.
I exited the basement. I came to the surface. Now I'm in Miami, but not in the basement. We'll just leave it at that. Not in the basement. I graduated out of the basement.
Already a friendlier place. So before you get to your tips, are these going to be tips for me as a practitioner or for owners to do? Or am I supposed to give a memo to the pets? Like, who are these tips going to be for?
Well, they are for anyone who is a human and can listen to them. And it is just sort of a framework for considering the way a pet might perceive anything. It doesn't have to be a veterinary hospital per se. It could be anything, any stressful or potentially stressful event. So I like to divide it into the animal's senses. And the first sense that a pet uses when they perceive something is their sight, or maybe not the first, but the first one I'm going to talk about is the way we look or appear to the pets.
Okay, now I have to worry about the cat's opinion of my fashion choices for a Tuesday. Is that what you're telling me?
Well, how does your environment look? You know, if someone's coming in to your animal hospital and they've got their cat in a box and they set the box down and the second client's nosy pug is snooting and snorting right in the door of the cat carrier, or maybe there is a dog that is lunging and barking. I mean, you know, what does that look like to a cat to be backed into a corner that way?
It's what she's saying is stop being such a narcissist. It's not all about you. There's much more involved than what you as a veterinarian looks like. I think that's a very good point and well made. So it's the entire environment.
I love that totally appropriate description of the pug, seeing the world with their nose first, right? Snarfling, snooting into the crate. That's excellent point. Yeah, I'm not a cat, and I don't think I would enjoy that. But what about the pug? So you're telling me now also I should kind of look at it through the pug's eyes? Also?
I think that you should. I've even encouraged people to go through their animal hospital or their environment and maybe even take their cell phone on a selfie stick or something and put it down at the level the pet sees and look at stuff that could be a threat. Are there things that look scary? Are the assistants, like for example, on Halloween, my assistants love to wear costumes and headgear and things, and I'm like, no, I don't think that that's a really good idea when we're seeing patients because that seems scary to puppies and kittens and just animals. Oh yeah, they don't like change.
Yeah, they don't. Well, neither do humans, frankly. But however, you're right on, because I've seen dogs that are perfectly happy with a person, and the person puts on a baseball cap and they flip out.
Whole world changes.
Oh yeah, the whole world changes, exactly. I'm not really sure that I want to get down on the floor level and see the dust bunnies that are all over the place. But I do get your point, and so
listen. Hold on, Jen. I don't know. I think that's not a bad idea. I would probably not even have the selfie stick. I would make everyone get down and see it. You're expecting these animals to be comfortable. You might as well see what they see and put yourself physically in their position. I think that's an excellent idea. And have the entire staff do that, and then video it, of course.
Video the staff, and then send it to myvetcandy.com.
Yes, that's absolutely. Everyone's crawling around looking, but that's a very good point.
It is.
So we made a video. We took one of my team members' dogs, and we put a GoPro camera on his head, and we walked him through the animal hospital, and we did a mock, here's what you see when you walk in the front door, here's what you see when you go into the exam room, and we did a mock visit. And it was very eye-opening for me. It really was.
This is why we said you were smarter than us. We, of course, would have been on the ground with our phones looking like a bunch of fools. And you just said, why not just use technology and put it on the dog or the cat? That's fantastic.
Yes, that's awesome.
All right. So we like your first one. That is an excellent point so far.
That's a great one. Okay. And actually, I should mention to everybody that Dr. Prim is not just doing a podcast with us to talk about this, but in the Candyverse, we think that it's so important that pets and their owners enjoy the veterinary visit, that there's actually a guide to happy customers that VetCandy has out. And it's a free download, so you can download it for yourself. If you're a pet owner, you could take it to your veterinarian. That'd be a bold step as an owner.
Pretty bold.
Yeah. Or as a veterinarian, you can download it, share it with your staff, get some ideas. It's at myvetcandy.com/ happy. And Dr. Prim and actually VetCandy's own founder and CEO, Dr. Jill Lopez, worked on that together. So, all right. So number one, we have see your world as they see it. What's your second tip?
Okay, the second way that I think is helpful is to hear the world the way they hear it. So have you ever been at work and maybe there's a dog dropped off in the treatment area or in the ICU that is going, and then you have a cat come in and the cat hears it and it's just ultra stressful. So you have to think about, what do they hear? Do they hear your phones ringing crazily? Do they hear other patients vocalizing? Do they hear your team members on break in the back singing or, stomping? What do they hear? And I think that is really important. And possibly, what are your clients hearing too?
And so that's important everywhere you go. I was at the dentist once sitting in the exam room, and I love my dentist. Nothing ever hurts. He's fabulous. And so is my hygienist. But you could hear the drill in the lobby and they were working on somebody. And then it sounded like somebody groaned or moaned or whatever. And then there was another noise, like a scream. I can't imagine what was going on back there. The dude got up and exited.
Yeah.
He exited the lobby.
I would too. That's crazy.
He was a no-show for his appointment because he couldn't handle the sound effects coming from the back.
But I think you just made her point, right? And these poor animals hear all these things and they think, what on earth is happening? This is a scary place, and they want to leave, but they can't. So they just get really stressed out. So that's
exactly.
Yes.
And it puts them in a fight or flight situation where they feel they have to defend themselves. And that is a risky situation for everyone, for pet owners, for the pet, obviously, and for the veterinary team, for an animal to feel like it's going to have to defend itself. That's a bad situation.
Oh, yeah, because they can't flee So, okay, great. Let's see. We've done sight. We've done hearing. And so what's next?
What about what do they smell? So as human beings, yes, you are. And I'm glad that you're picking up on that.
I am.
So as
Gold
human
star
beings,
for Jason.
We don't perceive smells the way pets do, but we do smell things. I mean, if you'd gone to your dentist office and it smelled terrible, if you smelled blood, wouldn't that have made it even worse?
Oh my God, I would have left if I smelled blood at the dentist office.
Or rumen contents.
Right. Well, okay.
Ooh, yikes. Yes.
Oh my gosh.
Yeah.
So think about it.
You see, Dr. Jason, this is what I'm telling you about personal hygiene.
Oh, great. I
important.
don't know why you had to bring that up, but whatever. This is a podcast, not a smellicast. All right.
That's right.
So think about the way you remember things that are associated with scents. Someone posted on Facebook that there is a new mural at my veterinary college in the large animal corridor. And when I saw that, I could smell DMSO in my memory.
Of course.
That's right.
So, we underestimate how important smell is to the way pets perceive. And on a side note, there are also chemicals that pets can perceive that are not specifically odors, but are pheromones. And that can make a huge difference as well.
Like what? Do you got an example of one of those?
I do. You know how when your cat is loving you and rubs on you, rubs her face on you
all the time?
Yeah, those.
I
you
don't
know
that.
that?
No, it doesn't happen to me.
Maybe
I have
his
no
cat
idea.
doesn't love him.
It's a sad day.
Go ahead.
But that's actually depositing a pheromone on you that identifies you as a treasured affiliate or a safe place. Yeah. So
I'm treasured.
Yes.
Treasure. Me and Bruno Mars, right? Bruno sings about me because I'm treasure. Yeah. Okay.
Well, maybe to your cat. Maybe to your cat, which is why we have cats and dogs.
That's right. Okay. Interesting.
So these chemicals have been created in a lab in a synthetic version, and we as veterinary professionals and pet owners can utilize this synthetic version of the pheromone to help cats feel safe in places that we need them to be. So maybe they're a cat carrier, maybe the car, maybe the veterinary hospital, but we can take advantage of the science of pheromones to help make anxiety better for pets.
Excellent.
So
Excellent.
listen,
Okay.
I've heard about these things and used them or whatever, but and you think that they really work? Because there's a bit of controversy, I think, not controversy, but there's always the naysayers. Oh, they don't work. That's just people trying to get you to spend money. But you stand by it, correct? You say use them. It doesn't hurt and will most likely improve your cats and dogs, or just strictly cats behavior.
Dogs and cats. You
Yeah.
know what? I'm a naysayer too. I'm really skeptical because I feel like there are lots of things out there, but this is not one of those things because I have seen this work, and it doesn't work the same for every cat or every dog. But I have a Labrador Retriever patient that she expresses her anxiety with hyperactivity and hypervigilance. And I sprayed one of these synthetic pheromones on a bandana, and I put it around her neck, and it was instant. I mean, I was even amazed. She instantly, and the owner said, can I get some of that?
Right.
Of course.
Yes, we're bottling it and selling it out of the back.
Yes.
You're the man employed as a carnival barker. No, I'm just kidding. Hey, so you guys, what, Dr. Cat, is there any smell? Because, veterinarians, we have to smell everything, right? We got to smell all kinds of stuff. Are there any smells that you can't stand? What smell is that you can't stand?
There are, and the things are things that I have associated negatively. So that's kind of my point. Think about, I don't know, all the veterinarians and veterinary professionals will relate to this.
What is that smell, Dr. Prim? We're getting a little personal. Tell me the smell.
What about, I hate the smell of Pseudomonas bandages.
That is so oddly specific, but yes,
very true.
Very true.
Right?
I challenge you to find someone who likes that smell.
Yeah.
Who
Exactly.
who doesn't hate that smell. That's
Jason,
true.
Any smell that makes you retch?
Any smell that makes me retch associated with veterinaries, animals, and veterinary
Not just
medicine.
anything.
Well, as soon as you brought DMSO up, I sort of started, dry heaving a little bit.
Yeah.
So I think that's more associated with school and the large animal clinic. And I don't want to say bad things about it, but that brings up some difficult times in my life.
Yeah.
So.
Yeah. It's true. All right. So now that we did the negative smell, what's the happy smell for you guys?
Well, I like lavender.
Oh,
and actually, studies have shown that dogs like lavender too, and cats possibly, that those smells can be calming for pets. Now, it's not like you're going to whip out a lavender plant and all of your patients are going to become catatonic. It's not like that, but it is something that might be calming, that's easy to do, and it causes no harm. So, I like that.
Interesting.
Lavender, very good.
Jason, yours besides chocolate?
Well, not anything chocolate, of course, but so like leather. I'm being serious here. Leather smells great, right? A boot shop, a tack shop. Not that I'm a cowboy, but anytime I pretend I am and go to a boot shop, it's fantastic. I love it. So that's a little too personal for me. We can move on with some other stuff, but
no. What about a high-end car with leather upholstery?
Of course, that's great.
Yeah, he's turning red now. Look at him. Oh, y'all can't see him. He's the lovely shade of chartreuse right now.
I don't even know what that is.
Love it. Okay. All right. So back to on task here, people. So that we can get through our tips.
That's the person who's asking us about smells. Great.
Well, just asking because everybody has I've smelled a lot of stuff, right? And I can tolerate a lot of it, but there's two things, and then everyone has a happy smell. I'm always interested in what people's happy smell is.
Okay, so let's take a quick break and we'll come back and hear the rest of my VetCandy adventure. We'll be right back. Hi, this is Dr. Catherine Prim, and I would like to make you aware of some products that I've discovered. Dr. Elsie's Pet Products. So you all know that I have a cat named Scamper, and Scamper is a little bit sensitive. So I have to choose sort of special stuff for Scamper. Dr. Elsie's Ultra Litter has been kind of a godsend for us. It's made with clean ingredients and it's low on dust, so it sort of addresses the needs that Scamper personally has. You can feel really good about choosing Dr. Elsie's Pet Products because they're veterinarian formulated and they're tested. So they combine science and the love for pets to meet the needs of even the most sensitive pets like my Scamper. Here's the really good news. You can get a rebate. Dr. Elsie's will pay you up to $20 for your first bag of Ultra Litter or any Dr. Elsie's litter by visiting drelseys.com/Dr. Cat. That's DRELSEYS.com Dr. Cat, which is DRKAT. So check it out, give it a try, and get up to $20 back.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to 9 Lives with Dr. Cat. And I'm your host, of course, Dr. Catherine Prim. And today we are listening in on my interview with VetCandy, Doctors Jen and Jason Chatfield. We talked about making veterinary visits better for pets. So welcome back. We'll pick up where we left off.
Okay. We're talking with Dr. Cat Prim and talking about some ways to make happy veterinary visits for patients and for owners and for veterinarians, frankly. So we have 2 left. We've done sight, hearing, and smell. Dr. Prim, lay it on us. What's the next one?
So what about taste?
Okay, I don't like for patients to taste the veterinarian. I just think that I've already lost the battle.
This is true, but I don't think, again, stop being such a narcissist. I don't believe she's talking about you, okay? All right.
Okay. What do you mean?
Enlighten her, please.
What about if they associate you with things that taste good? Like maybe you always have treats in your pocket.
Oh, yeah.
Because then you address more than one sense because they can smell the treats. Mm-hmm. My patients know I carry a basket and it's got treats in it, and it's also got my stethoscope in it and some of the other things, my otoscope and stuff in there. And so that all of my tools smell like the treats. And they all come from the basket with the treats. So if I walk into my exam room and it is a patient that I have seen before, they're happy to see me, which I take very personally, even though I realize that it's the basket. I still feel like, they're happy to see me. And
they are happy. because you have the basket.
Do not tell me otherwise. It's not the basket. It's me. So, yes, taste is something that we use to our advantage every single visit.
Okay, but how many cats actually, because I have trouble with cats, and my own cat, like she wouldn't take a treat from anybody, even me hardly. She was weird. Like cats at the vet, in my experience, they don't take treats very well. So how do you have cats that actually accept the treat from you?
I do. Have cats, especially if they have grown up seeing us. Sure. Yeah, so that they know that that's coming and they're anticipating that. Mm-hmm. But with cats, sometimes the treats, you just have to try everything. There are toys and other stuff with cats that we can use. But yeah, if they smell, cheese, spreadable cheese, or they smell good things, it puts them in a better place emotionally, I think.
The emotions of the cat. I love it. Things we cannot control, right? The emotions of the cat. Okay, so we're down to the last sense-based tip. So what is that? It's going to be touch, right? Because that's the only one left?
Right. Very good.
Oh my gosh.
Do I get a treat for that? I think
you get a star
for that.
and
you get a gold star.
Yes.
Excellent. Thank you. Okay, so what is that going to look like for us in the exam room?
So I kind of modified touch a little bit and just say feel. What do they feel? We have to do things to them as veterinarians that don't feel good. Mm-hmm. And that's a hurdle. So we use distraction. When we're administering vaccines or injections, when we're doing things that might be perceived as not fun, then we just sort of displace that onto some of these other senses to distract from that.
Interesting. And, pediatricians do a lot of this stuff too. Because, if you're going to give a kid a shot, most kids, although I've met a few that stare at the administration site for the shot. Jason, some of them. And
I do.
And then others like me, I can't look when they're giving it, but if I'm distracted, maybe I don't feel that poke. So I think that's a good.
How do you distract them? How do you distract a cat while you're giving them an injection? What's one example of how you can do that with other senses? Just pet them somewhere nice, scratch them on the chin, what?
Well, first with cats, I always make sure that I let the cat choose where it's going to be. Some cats want to stay in their carrier, so I encourage all of my cat owners to have a carrier that opens on the top so I can reach in and do what I've got to do. But I have a window perch in the window of my cat exam room. And very, very often my cats will sit there and there's a bird feeder right outside and watch the birds and not even notice the vaccines at all. So they're really brave. Cats are really brave, maybe braver than dogs.
What?
Oh, I think there's zero question about that. I don't even know why we're bringing that up. The least brave cat is braver than the bravest dog. I mean, there's just no question.
Maybe.
It's an adaptation, not a choice.
Right. So let me ask you this since you're on, because I know that the market. So as a veterinarian, that the market has changed, and we have this option for low volume vaccines. And I know we're talking a lot about cats because, frankly, we're talking with Dr. Cat. But what do you think about that? Is that something that practitioners should consider, or clients maybe should inquire if their veterinarian carries the low volume vaccines? Are those better, or like, what do you think about that?
Well, I think it's all about the tools that you choose. And like I said, having your stethoscope smell like Easy Cheese or, those kinds of things. And I think the type of vaccine that you choose could play a role as well. Choosing the lower volume ones could potentially be more comfortable. Definitely lower gauge needles, and always change the needle. Because by the time you've reconstituted a vaccine and punched through 2 rubber stoppers, it's not going to be as comfortable. So a new lower gauge needle, a vaccine that is high quality, ultra filtered, lower volume, those are all things we could consider to be an animal and think about what this is like from our patient's point of view.
But I think it's also important from the veterinary standpoint that we don't just get in kind of tunnel vision looking at what's comfortable for the patient. Because frankly, one of the things we do most often is, thank goodness, our preventive medicine or wellness visits, right? Where we're doing a lot of vaccination. We have a lot of preventive health tools available for pets. And so I think it's very important that we select not only one that's comfortable for the patient, but one that's proven, proven efficacious, et cetera. Because, in the Candyverse, you guys are aware of my love for infectious disease, but also my firm allegiance to vaccine prevention. And so I think it's important that if you're going to pick a low volume vaccine in order to make it an easier administration, and you're going to use the small gauge needles, as Dr. Prim suggests, I think it has to still be a proven efficacious vaccine. Wouldn't you say, Dr. Prim?
Absolutely. It's not going to be using one in an off-label sense. Use one that's proven and that is packaged and intended to be a lower volume vaccine. Absolutely.
Yeah.
Those are all interesting questions, and it's nice to talk about science. But I have the most important question I think is on everybody's mind here. Are you ready? And it's going to answer a lot of questions here.
Prepare yourselves.
All right, Dr. Prim, what color should I paint my exam rooms and my lobby? I mean, that's got to be on everybody's mind, right? I there's a lot of discussion about this. Do you have an insight as to what can help me with the exam room? What's going to calm all the animals down?
Well,
including the humans.
Once I decided I was going to paint my kennel, and I was going to do it like a preschool, and I was going to make it really cheerful. And it was green, like a crayon green, and red, and just really cheerful. And that was a really bad idea. So,
Why? Well, why? I mean, we laugh, right? But why was it a bad idea? Do you think it caused a change in behavior?
I don't know that. I can't say for sure. I didn't do a scientific trial, but it kind of made it sort of stifling and scary in there. Now, studies do indicate that certain colors can be inflammatory. And if we think about it, the bullfighters wave a red flag, So although you have choices, but I have chosen to paint my facility in soothing colors that are thought to be calm, not only for the pets, but for the clients. So, because it's an anxious time to be at a veterinary hospital. I have soothing music. I have calm, soothing colors on my walls. I don't wear a white lab coat because everyone is associated that white coat syndrome, that makes everybody on edge. I don't do that. So you're kind of jesting, but I think there's some validity to that.
No, I actually am not jesting. There's been many discussions. Should we paint it a light blue? Should we paint it a light yellow? And I think that there's some aviculturists that gray that will swear by blue, and for birds, especially birds, and blue makes them super calm. And I'm sort of a conservative kind of person, and I'm not going to paint it red, right? I don't think anybody is, but there may be, I didn't know if you knew of some subtle differences between yellow and blue and gray, and I was assuming that, the calmer the color, the better for everybody. But just thought I'd ask since I have the expert here on the line.
The blue from the sky, that makes complete sense to me for birds.
Sure.
Well, and then I have another question too. And I mean, I guess maybe you've given us the information that I could arrive at an answer, but because of the way that you have tied it all back to the five senses. But, I guess it was a handful of years ago. Well, not a handful now. It's been a while.
a big giant handful.
Right. The giant that Jack found at the top of the beanstalk, his hand full of years. When we started recommending that practices separate cats and dogs as they're waiting for their visits. And so, some practices will have like cats on this side of the waiting room and dogs on the other side. Is that separated enough? What should I do if I really want to use that as one of my tools to make it a better visit for both dogs and cats? How far do I have to go?
Well, I actually kind of eliminated my waiting area, my reception area, when I remodeled my practice.
That's pretty far.
Yeah. So I have a small retail area, but it is not a place where live animals wait. That's a recipe for disaster. You've got cats in boxes, dogs on leashes, bottlenecks of clients.
Dr. Prim, you don't have to tell me. I love everything infectious. I am fully aware of the petri dish known as the lobby.
Right. Well, so mine is minimized. And when the clients, and we schedule, in a way where we kind of know who's coming. Yeah. But when a client arrives, especially with a cat, we put them directly into the exam room. So the cat doesn't have to experience the dogs, because I treat dogs and cats.
So just separating. So is that exam room only for cats?
It is.
Okay, so a dog never comes into that feline paradise known as your exam room.
Never does a dog go into the cat room. Occasionally we get really full and a cat will have to go into an exam room that has been attended by a dog, but never does a dog go into the cat room.
Whoa. The cats are loving that. Wow.
They do seem to, and it's got a window with the window seat, like I said. So, and it's kind of.
Oh, yes. I meant to bring that up. I forgot about that. I think that's the number. That is such an awesome, and maybe I'm just way behind the times, but it's such an awesome addition if you can do that. I've never seen one, but just thinking about a window seat for a cat while you do an exam, I mean, excellent. With a bird situation on the outside, that is well thought of.
If the sun could shine.
I would love to see that in action. That's fantastic.
And also if the sun could shine all day long on that window seat so that the cat could bask a little bit.
I mean, I'm assuming that she has a fake sun on the outside, so even on rainy days, there's a sun there, right? So
right. We are thinking that Dr. Prim might control the sun, the moon, and maybe some of the stars.
Could be.
Because these are incredible tips. And, as an owner, I think that I would start to look for these little, these, because they're kind of subtle things that you're describing. They're not super hard to do. So I would think that most practitioners could do it. So as an owner, I might start looking for that in a practice. Do you recommend that for owners?
To look for a practice that prioritizes the way their pet sees things? Yeah.
I mean, when you say it like that.
You say it like that, it's a no-brainer. Why would you go anywhere else?
Hello. Yes. And so that leads me actually to my other tip for those in the Candyverse who are listening is that in our VetCandy Guide to Happy Customers, there's also lots of great marketing tips for practitioners and practice managers. And I think as an owner, you can use that guide. You can just reverse those. And instead of taking those actions, I think you look for a practice that's taking those actions. And those, again, are from VetCandy's own founder and CEO and marketing guru, Dr. Jill Lopez. She's gathered those from folks such as Dr. Prim and through her own experience. And I think that's a little bit of a novel approach, looking for marketing that. So, okay, Dr. Prim, is there any one tip that you think practitioners miss all the time that you want to share with us as we come to a close on our discussion of happy veterinary practice visits?
Well, it's be an animal, right?
Mhm.
So I think that the one thing that is missed most, and I'm in my practice now a lot, and I'm not in a lot of other practices, but I think addressing the fear of existing patients in addition to the one that you're seeing right that minute is something that's easy to do, like your post-surgical patients, which are experiencing some anesthetic excitement phase or what have you, and then the ones coming in the front door are hearing that. I think addressing the issues of the pets that are already there, or maybe you have a boarding dog that is anxious in the boarding kennel, and here you come with another dog, and then everybody's anxious, and it just becomes sort of infectious.
Oh, it's like my niece and my two nephews. If one of them was screaming and unhappy, it would get all over the other one. Isn't that right, Jason?
That never happens. I don't know what you're talking about. That's untrue for kids. That's not.
What
excitement is not contagious. I use pheromones and blue paint and all kinds of good smelling stuff, so they're very calm.
Oh, I just use candy.
Okay, got to work too.
That's why Aunt Jen's their favorite.
Yeah, right.
Okay, but I digress. But still, it is, I think, as you mentioned, Dr. Prim, these are easy things that I think everyone can tailor to their practice or tailor for their pet. Because I think the Great Dane is going to see something a little differently than the Frenchie. And the cat sees it different than everybody else. So I think that that's how we have to approach this sort of thing. So, Dr. Jason, do you have any other parting questions for Dr. Prim while we have her?
No, but I am looking forward to the video of everyone crawling around on the clinic floor at different levels with a camera on their head just to show the commitment that the staff has to making the animal. And I would seriously put that on a loop, right? That is awesome. That is fantastic. Look how much we care about, comfort for your animal while they're in this clinic situation. So really good. I want to see that on the website very soon.
Jason, I want to see that on Facebook Watch for VetCandy. I want to see you checking out a clinic for Dr. Prim's tips on being an animal.
It's no problem. Dr. Prim, send me a ticket. I'll come right over there and do it right now. No problem.
Well, you wouldn't find anything scary in my clinic. You need to go to
find a different. Yeah, that's right. Well, quality control. Quality control is what it's the name of the game.
That's right. That's right. Well, thank you, Dr. Prim, so much for joining us today and enlightening us in the Candyverse, how we can really make the world a much happier place for our patients and for our pets, and in the end, for our veterinarians.
So thanks for listening to 9 Lives with Dr. Cat. I want to thank all my loyal listeners. I hope you learned something today about making veterinary visits better. And I also want to thank my producer, Mark Winter, because without him, this show would not exist. I want you all to go out and have a perfect day.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.